Thank you for watching the World Community Magazine's Hour of Power Live on Facebook with your host Edward McQueen and April Garner Davis.
We can't hear you, Brother Edward. You're muted.
Yeah, I don't like to do that. Good evening to everyone. Good evening to you, Ms. Davis. How are you? Ms. Garner?
I'm great.
Davis?
How are you doing?
Mm-hmm. Oh, good. Fantastic. April, today, well, first of all, welcome our audience. And we're glad to know that all of you who are tuning in. We'll certainly appreciate that, and hope to have some good knowledge for you today, as usual. And speaking of that, we want to talk about cognitive resilience. And as you all saw the title there, see what neuroscience says about cognitive resilience. I know, and those words are not big words, okay? Maybe big words to some people, but you'll find out that it's going to be very helpful, especially with our guest who's going to be coming on this part of the show to talk about that. And all that has, just to say a little bit more, all that has a lot to do with dementia. That's an umbrella, strokes, and so forth. So it's going to be very helpful towards our cognitive health. And having said that, April, you can tell us about who's going to come on first, because we have some very important information about.
You can introduce our first guest. Yes, absolutely. Go ahead. You're doing well.
Yeah. Oh, okay. All right. All right. So none other than the person who's is really pushing our Whittemore legacy, something that's some of the people have forgotten about, but she's been pushing it very hard, and we're certainly proud of her and glad to know that she can come on and talk about the upcoming event to push it even further. Okay. So without ado, we were talking about Reverend Cheryl Moore Adamson.
Amen. Amen.
Who's with us today to take us a little bit further into that.
Okay.
Well, she's laughing as if I said something wrong. Yeah.
Well, no. I was just excited that you said more, because we have to keep Covell at the forefront. My daddy, Reverend Covell,
yeah,
is 99 years old tomorrow.
Oh my goodness!
Wow!
Yes.
Wow!
Yeah. So yeah.
He would have been 99. Yeah.
Mm-hmm.
Wow!
Well, Mrs. Moore not too far behind, and
right.
she's with
97. Yes,
and she's with us. Okay, so
Mm-hmm.
glad to hear that. So, Reverend Adamson, we're anxious to hear about this upcoming event. If it's going to be you think it's going to be as good as last year, then we're in for a treat.
Absolutely. This year marks a pivotal moment in our community, actually, in the nation, because the nation is marking the 250th anniversary, so-called, of this nation. If you begin at 1776.
You're right. Yeah.
While the rest of the world is looking at that, we are taking the time to pause and reflect on our shared history, and to keep on the forefront the contributions of African Americans who've helped to shape at least Horry County and even beyond. So the Whittemore Race Path Historical Society is honored to present Honoring Our Legacy, the 3rd annual Heritage Gala. And this time that we have is dedicated to remembrance, gratitude, and forward-looking hope. You all know that our organization was officially established in 2021, but our roots extend beyond the loss of the historic Whittemore Elementary School building. And we broaden our mission to ensure that African American history of Horry County is preserved, celebrated, and never forgotten. So this gala that is going to occur a week from this Saturday is both a tribute to the trailblazers who came before us and a call to action for those who will carry the story forward. So we want to invite the entire community to come together to be with us on Saturday, April 25th at 6:00 p.m. the Mason Temple Fellowship Hall at 1507 7th Avenue in Conway. The tickets are $65. We will be honoring 10 magnificent people from our community. And we will have 2, I guess you would say 2 or 3 posthumous awards. That is people who have already gone on before us and are in that great cloud of witnesses in heaven. And that is the Reverend H.H. Singleton. And we're honoring the legacy of Wright's Groceries, Mr. Arthur Wright, and McKeever Funeral Home. But aside from those people whose memories we want to bring forward, we are pleased to look at the legacy of Mr. Ralph Vaught in law enforcement, Reverend Dr. Kenneth Floyd in community service, Brother Franklin DeWitt, which is another posthumous award, a trailblazing attorney in our community. We want to honor nurse Sherrod Dennison Norman, who was a pioneer as a supervisor at Conway Hospital in OBGYN, along with the educator, the great Leroy Rainbow, and the educator, the great Mary Owens of Bucksport, South Carolina. So we really are excited to have them and their families come in. Our speaker for the event will be Michael Allen, one of the products of Conway High School and a legacy of Whittemore High School, who is an architect in Atlanta, Georgia, who began this fight with us over 4 years ago, almost 5 years ago. Well, yeah, 2021. That, Lord have mercy, 5 years ago, when we were fighting.
Creeping up on you.
Oh my goodness, this is crazy, man. This is crazy work. The dragging of the feet regarding that property. He's going to be our speaker. Our MC is going to be Chris Hennigan, trying to bring our young people into the fold. Our music will be by Tamir and Company. And we want to invite you not only to honor these people who you've grown up with, that you've gone to Whittemore with, that you've served with in the community, that you serve in various churches and organizations with. Come and say thank you to them and to their families at $65 each. We also have sponsorship levels. We have a gold sponsor of $2,500, purple sponsor of $1,000, and we have a patrons list where your name will be listed in the banquet program, anywhere from $100 to $999. So if you want to get tickets, Marsha Ransom is our treasurer, and her number, you may be able to see it, 843-855-2917. And others of the members of our organization, like Sister Valerie Skipper, who is the chairperson of this event, are able to provide you all with tickets. So that's the gist of what we will be doing next Saturday. If you have any questions, for me, Brother McQueen or Sister Davis?
Okay. I thought, did I hear you say Dr. McIver was going to be one of the honorees?
Yes, sir. Yes, sir. In medicine.
Okay.
Thank you for that.
McIver. Dr. Winston McIver, Jr. Okay.
Yes, sir.
Yes.
Mm-hmm.
All right.
Yeah, we want to give these people their flowers while we can touch them. Yes.
Yeah. While we can touch them right now. Mm-hmm. And I'm all for that. So, well, thank you so much for that information, and we're going to certainly wish the best for all. I tickets are probably sold out. I don't know, but that's a hint, right?
Oh, that's a hint. Well, we'll let you know by next Tuesday night if we have any tickets left, but hopefully, people who want to say thank you while there's time, or to look back and say thank you for those people who had an impact on their lives and on their families' lives. We really need to be able to do that. So we're inviting each and every one of you to come and be with us next Saturday night.
Okay, all right. Starting at 6 p.m.
Yes, sir.
Mason Temple. A lot of parking spaces there available.
Yeah.
Ample
So
parking. All right.
be there or be square. And I know you two are not going to be square.
All right, Reverend.
All right. Thank you
All
so
right.
much for us this time.
Okay. We appreciate you getting that information out to us. We want it to be success. And if it's anything like last year, I know it's probably going to be better, but there you go. Thank you so much.
All right. God bless you now.
All right.
Bye-bye.
Godspeed. Okay, April. Now let's go to I'll stop to say let's talk about the brain, but I guess that's what he's been researching on. So we're talking about neuroscience, and under that umbrella comes cognitive resilience. So none other than our health editor for the World Community magazine is Mr. Christian Newman. So how you doing, Mr. Newman?
Good evening. How you doing? I'm doing well. Can't complain.
Well, why were you so anxious to come on, man? You've been.
I'm excited to talk about the brain. I'm excited to talk about neuroscience.
Yeah, well, that's good. That's very good to see that kind of vigor, kind of energy that's coming from you,
Yes,
and we're certainly glad that you can share that with us. So, Kristen, for those who I know a lot of people just reading the magazine, so they know you and they've been reading a lot of your articles. So, in the event that someone is missing, can you just give us a little background, man, on yourself, and just very brief, because we want to get to the topic. A little background on yourself. Yeah,
yes,
right?
sir. So my name is Christian Newman. Born and raised in Myrtle Beach, South Carolina. Went to Sox City High School and the Academy for the Arts, Science, and Technology. Oh, yes, ma'am.
Can you turn your volume up a little bit?
Oh, yes, ma'am.
Yes, it's kind of hard to hear you.
Let me see. Can you hear me now?
It sounds like you're in a tunnel.
Okay.
Yeah.
Know what that is.
If you have earbuds or earphones that you can plug in quickly, that would be probably a little bit better.
Okay, let me go get those really quick.
Okay.
Yeah.
All right. So Brother Edward, how long has Christian been the health editor for the magazine?
I think a year and a half, maybe. Year and a half. Pretty close to 2 years. It's at least a year and a half. And it's come up with some very good literary research, and especially in the fields that he is well versed in, but quite versed in, and sharing them with the audience. In our latest edition of the magazine, he talks about. Let me just pull that up for a second here. Refining women's health from the inside out, and here's something. It has some good graphics on here, and of how these things and everything that's relative to that, proactive care, and then such things like that for women's health. Anyway, the topic that was the title of his article, and hopefully, people could take note of some of those things that he had in there, the research that he did regarding that. Even though Women's History Month was month of March, I believe, it was last month, I believe. But it seemed to be hitting a lot of things on point, and that to me, that's really getting down to it, because you ever so often you hear, especially from Black women, things like their visits to a doctors that don't seem to understand their care or their needs. Okay, I've been hearing that here recently, and I've been reading the same thing. So he touches bases on that in his article, and I thought it was quite interesting, and I'm very proud that he's part of the staff, and I'm very proud that he's our health editor. To come up with things like that. He's going to come on. He's going to come on. Oh, he's back.
It looks like we have him back. Yeah. Okay, now, Kristen, let's see.
Can you hear me better?
It kind of sounds the same. I don't know what it is on your end, but
okay.
Well, I can hear him quite well, April. It's not on your end?
It's not on my end because you sound totally. You sound clearer and your volume is more pronounced. Christian sounds like he is in a tunnel.
Okay.
And yeah, like you're standing away from your microphone, like you're across the room. So just make sure your voice projects while you're speaking.
Yes, ma'am. Yes, ma'am.
All right.
I sure will. Yes. So my name is Christian Newman, and like I said, I was born and raised in Myrtle Beach, South Carolina. I just recently graduated with my bachelor's degree at Furman University. And I'm currently doing my master's degree right now at Furman University.
Right.
So I'm loving it. It's in community engaged medicine. I'm graduating here in May, and it's a whirlwind. I also recently got married to my beautiful wife Alexis, who is also an aspiring physician. It's a beautiful life that I'm a part of. So
there's this achievement that Alexis just got, and I'd like for you to talk about that. Just briefly.
Sir. Yes, sir. So she recently got accepted into the Medical University of South Carolina, right in Charleston, South Carolina. So we are so excited. They have an amazing program, especially their pediatrics program, which is what she's interested in.
Right.
So we are super excited for this amazing opportunity.
Fantastic. Great.
Yes, sir.
Fantastic.
Yes, sir.
Fantastic. All right. Well, you can go and give us a good elaboration on your topic for this evening, if you like.
Yes, sir. So I will be talking about neuroscience, and this topic is super important to me because recently my grandmother passed away of a glial brain tumor, and it was very tough on our family, and she didn't even know she had a tumor. So I was like, let me do some research on neuroscience because I do anatomy labs, and I've done anatomy labs in my bachelor's degree, and I've done anatomy labs in my master's degree as well. However, I wanted to understand the pathology of the brain because I understand the lobes, which we'll touch on, the lobes of the brain, the 4 lobes. However, like I said, I wanted to learn about the pathology and the cognitive resilience. And my little sister is also interested in neuroscience, so I thought I'd do a lot of research for her as well to get her to dive in. And she'll be going to South Carolina next year, so yes, sir.
Wow. Yeah, Kinsley.
Yes, sir.
So how deep do you go into did your research? What's the outcome of your literary research that you've done so far?
Yeah, so just to start out, before we get into cognitive resilience, I want to just say that aging is commonly linked to memory loss, slow thinking, and reduced attention. So the brain, as we age, undergoes structural and functional changes across our lifespan. So you're not going crazy if you can't remember what you last ate yesterday.
Well, I'm glad of that, man.
You're not going crazy. It's completely normal. And I've came to understand that with my experiences in family medicine and emergency medicine, it's completely normal to not have that, to have those memory issues. However, it's important to realize the types of neurological disorders that can come into place because there's a difference between normal aging and preventable decline in the brain. So to understand the brain, once again, I touched on the lobes. So I'm going to go across those lobes. So you have your frontal lobe, which is like your executive function. It regulates attention, your working memory, and your judgment, and also your behavioral control. Then you have your temporal lobe, which is kind of like on the side of your brain. Have you ever heard of your temporal sinus? Yeah. It supports like your language comprehension and your memory storage. So you have your Wernicke's lobe, which is speech comprehension, and you also have your Broca's area, which is kind of like your speech production. Then you all have your parietal lobe, which integrates like your sensory information and your spatial awareness. Then you have your occipital lobes, which is your brain, which is your eyes here, and it processes your visual input. So your brain is kind of like an interconnecting. It's like an interconnecting, just an amazing region that has so many different functions within your body as well.
Great, man. April, you can jump in whenever you want. Okay. So
continue, Christian. I'm learning. Yeah. So you go ahead.
Yeah.
I'm sure I have some questions. Go ahead. Mm-hmm.
Yes, ma'am. Yeah, I sure will. And like I said, we've been talking about memory, so let's go ahead and touch on memory. So working memory or short-term memory allows like us to hold a phone number in our mind enough to dial it. Episodic memory lets us recall like a birthday party or a family gathering from years ago. And then we also have different types of memory, like procedural memory, that helps us how to ride a bike. So like I said, I wanted to kind of explain how our brain, how neuroscience kind of works before I go into the pathology, which is your dementia, which is your strokes, which is the different types of Alzheimer's diseases and Huntington diseases. And I see we have a question right there as well. How would a person know that their memory loss is aging and not something else? And that's a really good question. And it's something that my grandmother had to kind of deal with, because during Thanksgiving, we thought that she was 81 years old when she passed away. And we thought that it was normal aging. She had memory loss. But like I said, it's a gradual loss, and it's so tough for a person to truly know memory loss when they're aging and not something else. That's why we have imaging. So you're going to have your imaging there. You're going to have your MRIs, which is your structural magnetic resonance imaging, and they identify like your regional atrophy and your white matter damage. And then you also have functional imaging, which measures communication between brain regions during tasks. And then you also have PET scans, which is your positron emission tomography, and it can detect abnormal protein accumulation years before symptoms occur. So that's primarily in medicine how we know when memory loss is aging rather than something else, because that pathology will show on that imaging. Like if you see a picture of a normal brain and a brain with dementia, you'll see that the dementia brain will be a lot smaller than a regular brain because it's compressed. So that's how we kind of can tell, to answer your question, Ms. Fuller, about how we'll know if memory loss is aging rather than something else more severe.
So I wanted to, I was working on bringing up a picture of the brain. Because, I mean, we have to, of course, always be aware of our audience, and you're speaking from the standpoint of a medical professional,
yes, ma'am.
Soon to be and all of that, and already are soon to be in a different capacity. So I think it's interesting to hear about, what is considered to be a normal brain and what is considered, all of the things that may impact it, so that things like dementia and Alzheimer's and all of the clinical issues that we hear about, especially in the elderly, are occurring in the brain. So when you think about like the development of the brain,
yes, ma'am,
and the parts of the brain that actually control certain things, you may have mentioned it before, but I just wanted to bring this graphic up so that people will understand it in the context of where you're speaking. So this part of your brain stem, that's pretty much at the back of the head. Is that correct?
Yes, ma'am. So it's kind of like what we call the forebrain. For your cerebellum there, if you can see it at the back of the brain, that's in control of like your balance.
Balance.
And then, yes, ma'am. Yeah. So your brainstem is there, and then you also have your cerebellum. I'm trying to see the picture, but yes, your cerebellum right there is in control of your balance. And then, like I said, your frontal lobe, which is kind of the front of the brain, that's like the executive function. Your parietal lobe, which is, as you can see, kind of like toward the top of the head.
Top of the head.
Yes, ma'am. Your parietal lobe deals with like your spatial recognition. And then your temporal lobe, which is like right here, it deals with your language comprehension and your memory as well. And then you have your occipital lobe, which is kind of like it looks like it's in the back of the brain here, but that deals with like your visual input.
Oh, so that occipital lobe, even though it's in the back of the brain, it controls, you're saying, this part of.
Yes, ma'am. Yes. So that occipital lobe controls.
It goes around. Okay.
Yes, ma'am.
So when it comes down to conditions like dementia and Alzheimer's, is there a particular part of the lobe that clinicians see, I guess, kind of diminishing effects in, like, primarily, or like in the beginning, how does one even detect that you have dementia or Alzheimer's when you look at the brain?
Yeah, and that's a really good question indeed. And before we even go into that, I just want to kind of explain what dementia is, and what Alzheimer's is, and the different types of dementia, because I think that's certainly important to touch on. But that's a really good question. And first, I'll go into Alzheimer's disease. So Alzheimer's disease is very common. So it begins in the hippocampus. So your hippocampus is kind of like near the forebrain as well, and your hippocampus deals with like your memory and your problem solving. So that's Alzheimer's disease, and it's caused by like reduced blood flow, and that's where strokes usually happen. So that's when, and I'll touch on that later on about how we diagnose strokes and everything like that. And then you have dementia as well. So you have your vascular dementia, which is caused once again by reduced blood flow. And then your Lewy body dementia, which affects like your attention, your visual processing, and alertness. So to answer your question, the part of the brain that is affected with dementia. So with Alzheimer's disease, it's your temporal lobe, especially in the hippocampus. And like I said, that's near your forebrain, and it helps with like your memory and everything like that, and it spreads to your parietal lobe. So you'll start to notice that with your balance. You'll start to notice that with your spatial awareness. You're not sure where you are. So earlier on, you'll have like memory loss. You can't form new memories. Later on, you'll be confused. You'll be disoriented. You'll have difficulty with tasks. With vascular dementia, it impacts mainly like your frontal lobe. So you'll start to have like with your vascular dementia, you'll start to have like slower thinking. You'll have poor decision making, and you'll have difficulty organizing various tasks. And then you have your Lewy body dementia, which affects like your occipital lobe, which affects your visual input. So you'll start to have visual hallucinations, fluctuating attention, and you'll also have alertness changes. So those are the different types of dementia and how it'll kind of affect the body and affect your daily life as well.
And what's the typical age range that wherein Alzheimer's dementia usually is detected in people? Is it possible that it will impact young people, or is it really just more of an elderly condition?
Yeah, so it's less common. Once again, you'll have rare cases where it may affect the younger population. However, the typical onset for Alzheimer's disease, which once again is the most common form, is usually 65 years or older. Risk increases significantly with age. It can begin in your 40s or 50s. With vascular dementia, your typical onset is similar, like it's between the 60s and 70s. Key factors: if you have a past medical history of hypertension, diabetes, or prior strokes, you have an increased chance of getting vascular dementia. Wow. And then your Lewy body dementia, once again, it's between like the 50 to 7 range when you first start to see those symptoms come into fruition. Like you'll have fluctuating cognition, you'll start to have those visual hallucinations as well. So most dementias are seen after the age of 65, but some can begin much earlier, especially when behavior or personality changes are evident.
And you mentioned that there were certain conditions or indicators for dementia, like you mentioned hypertension and all of that. Yeah. Are there environmental factors, nutritional factors that also impact the brain and could cause dementia or Alzheimer's as well? Yeah,
and that's another good question. And that kind of ties into Ms. Priscilla Fuller's question right there about like, what is the red light to let you know you need to see a doctor? And for a lot of people, it's chronic stress for an environmental factor. Long-term stress increases cortisol. And to break it down, cortisol is our stress hormone. So the more stress that we have, the more cortisol is going to release. And it damages your memory centers in your hippocampus. Air pollution and toxins can also contribute to this. It's linked to faster cognitive decline. Education, actually, and mental stimulation and lower access to education can limit cognitive reserve. Access to healthcare can certainly contribute to this. Like I said, my grandma didn't even know that she had a glial tumor within her brain. So she had delayed diagnosis, which means that her life expectancy decreased significantly. And it was just tragic for us because it's crazy how fast a glial tumor can form within the brain. Diet and lifestyle can also contribute. So poor nutrition can contribute to inflammation within the brain and vascular damage. Also, your sleep can contribute to a dysfunctional brain. Poor sleep affects memory consolidation and is also linked to a buildup of harmful proteins within the brain.
So what? Give me a typical time frame on average of time that you feel something or you get diagnosed about a tumor on your brain, and that started at that point and ended up in a fatality. On typically, what were you talking about? 6 months?
So it depends whether it's an aggressive glial tumor or if it's so you have your aggressive glial tumor, which is cancerous, or you can also have a benign tumor as well. So you have your fast growing tumors, which is your high grade glial tumors. So that timeline, symptoms can appear in days to a few weeks. And those tumors,
Right.
I mean, it's unfortunate, but it's 3 to 6 months when you have a high grade glial tumor because it's a rapid worsening. The rapid worsening is common. You have severe headaches. You have seizures, like you have to be put on seizure medications. You have sudden personality or cognitive changes. You have weakness on one side. And once again, I can't wait to talk about the NIH scores, which is important with stroke scales, because it's important to call 911 if you're experiencing any of these stroke symptoms. And once again, we'll go into that in a second. But to answer your question, you have those high grade glial tumors and you have your low grade glial tumors. And those are typically benign. Symptoms can develop over months to years. And those often there's treatment for that. So the brain can adapt around them first. So that's what cognitive resilience is. And cognitive resilience, I guess I didn't even touch on that. So cognitive resilience is essentially the brain's ability to detour when there is a pathogen, when there is pathology. So think of it as like a highway. When there's not cognitive resilience, there's a lot of traffic buildup. There's not a lot to get around. However, when there is cognitive resilience, you can get around that. You can take a detour. So you don't want to have a lot of traffic buildup, especially with gas prices nowadays. So having a lot of cognitive resilience is really good.
Yeah. Interesting you threw that in about the gas prices, but I guess I'm really looking for some information regarding again, I'll go back to this time frame of when a tumor is being formed. Now, do you recommend getting more specific doctor's appointments to specify, even if you don't have any symptoms, but you're fearful of it, or what even your primary can do or say about being cautious about getting a brain tumor?
Well, let me ask the question first, Christian, before you answer that. Brother Edward, are you talking about tumors as it relates to the topic of dementia and Alzheimer's, or just tumors in general?
Tumors in the brain.
As it relates to what we're talking about today.
Yeah. Right.
Okay. Yeah. And Christian, I think maybe that's a good segue into like the 10 warning signs that you mentioned in the article. Yeah, because if that is, if there's some, I guess, indicators like Brother Edward is saying that you could possibly have a tumor, could one of those indicators be a warning sign also of dementia?
Yeah, and that's a great question. And like I said, within the article, I touch on that as well about the 10 warning signs. And it's important to understand that stroke scale because when I was in the ER, we did so many stroke scales. And whether it was patients coming in via ambulance or patients could either come in, just coming into the door saying that their brain is foggy. So the 10 areas of brain function is your level of consciousness, which is your alertness. Then you have your ability to follow commands. Then you have like your eye movement. They'll look at your eye movement and your gaze as well. They'll also look at your facial symmetry. So as you can see with people that have strokes, you'll see somewhat of a droop. So that's kind of like a main teller that doctors see. You'll see a droop in their face, and that you need to be calling 911 right away if you see some type of droop as well. With weakness in your arms and legs, you can have that bilaterally. You can have it in one arm. So you'll see limited leg strength. You'll see limited arm strength as well. Your coordination, your gait is what we call it. What we called it in the ER. And your coordination can be off. You can also have dysarthria, which is kind of like your speech clarity. You can have aphasia, which is limited language ability. And then you can also have your attention span as well, which is neglect on one side. So those are like the 10 components of what they'll test on a stroke scale. And that total range is from 0 to 42. So 1 to 4 is a mild stroke. 5 to 15 is a moderate stroke, 16 to 25 is a moderate to severe stroke, and then 26 and above is a severe stroke. So any of those symptoms, you need to be calling 911 right away. And to answer your question, Brother McQueen, I feel like it is always, especially as you continue to age, I think it doesn't hurt to get a neurologist. It doesn't hurt to get a primary care doctor, especially a primary care doctor, to get those wellness visits. Because when I was interning with Dr. Winston McIver, I did wellness visits and we would test cognition. We would see if they had any of those symptoms, any of those neurological symptoms where they can be sent to the ER, where they can be sent to a neurologist, so we can refer them to a neurologist. Yeah. So I think it is very pertinent to get, especially as we continue to age, to get a neurologist and to get a primary care doctor and to get the necessary testing to get it. Because once again, you won't even know. If you have a tumor forming in your brain. Some cases are like that, and then some cases you will know. But it's important to understand those risks and those symptoms as well.
And is there a correlation between strokes and dementia or Alzheimer's? Is there any correlation?
Yes, and that's another good question. And I also went through that with in my article as well. And yes, there's certainly a link to strokes, and there's certainly also a link to Alzheimer's again, because once again, the brain is an interconnecting region, and it's so complex. Like I wish you can, if you ever saw a cadaver of a brain, you would be it's breathtaking just seeing seeing what the brain, how interconnected it is, and it certainly has a connection because your brain connects to different areas in your body as well. Mm-hmm. So dementia is certainly going to have a connection to that for sure. Yes, ma'am.
Mm-hmm, mm-hmm. We have a request. Cynthia Smith Sherman, thank you for tuning in tonight. She said, explain the reason for brain fog. You mentioned it a few seconds ago. So you talk a little bit about that. And is brain fog any kind of an early indicator of any of these conditions?
Yeah, and that's another great question. Thank you so much, Ms. Cynthia. So brain fog is often linked to how well the brain is delivering oxygen and glucose within the brain. I talked about an fMRI earlier, and that's like your imaging, your functional magnetic resonance imaging. And your functional resonance, your MRI, your functional magnetic resonance imaging, will test that glucose within that brain. So brain fog is often linked to how well the brain is delivering oxygen and glucose, communicating between the interconnected networks within the brain, and it also regulates inflammation and stress hormones. So brain fog is not typically like a medical diagnosis. However, most commonly it includes like your difficulty concentrating, forgetfulness, slower thinking, trouble finding words, feeling mentally cloudy or fatigued. And common causes of this brain fog, Ms. Cynthia, is sleep deprivation, like I touched on earlier. It disrupts memory consolidation and attention networks. Once again, that stress and anxiety, your cortisol hormone. Certainly, your elevated cortisol affects the hippocampus, which is your memory. So once it affects that hippocampus, you start to forget things, like you start to forget, like I said, what I said earlier, Brother McQueen, what we ate yesterday. Mm-hmm. Inflammation, it's seen in more chronically, whether it's infections or autoimmune conditions. If you have blood sugar issues, like I said, with diabetes, especially fluctuations in that or poor diet patterns, that can also contribute to brain fog. Medications or substances can also contribute to brain fog, like if you're drinking alcohol, if you have antihistamines as well. So those are kind of like your brain fog. Well, it kind of fluctuates. However, Alzheimer's is more of like a progressive and worsening. It worsens over time. But you can improve brain fog with rest, hydration, sleep, or simply asking your primary doctor about different treatment options.
Yeah, I was going to ask about that. Like if you're doing all the things to, lower the cortisol, lower the glucose, all the things, and that doesn't work, what's the next step? And you're saying see your primary physician to discuss what's going on. Okay.
Yes, ma'am. Mm-hmm. Yes, ma'am. That's the main thing. If you're doing everything that you can, then it's time to go into a primary care doctor or a neurologist so that they can prescribe you some treatment. Because the first thing you want to do is to try to see if you can try to do anything. However, if symptoms worsen significantly, then you need to be going to see a neurologist or a primary care doctor. Yes, ma'am.
Okay. We have another question. Thank you, Tara Hill Starks, Richmond, Virginia, for viewing with us tonight. What happens during menopause when women get brain fog?
Yes, Yes, ma'am. And that's another great question. And this kind of ties into what Brother McQueen was saying about my women's health article. And I thoroughly enjoyed writing about that because women's health is so important. As I continue to know with my wife, it's important to learn about women's health. And I'm currently still learning about women's health. So that's a great question. So what happens during menopause when women get brain fog? So the biggest driver is the drop in estrogen. So men produce testosterone, however, women produce estrogen. And estrogen normally helps your brain support memory circuits in the hippocampus, which once again is your memory center. It regulates neurotransmitters like acetylcholine, which helps with your attention and memory. It maintains glucose metabolism in brain cells, and it also reduces inflammation. So to answer your question, Ms. Tara Hill, so memory and attention networks become less efficient within menopause when women get brain fog. So the frontal lobe, like we were talking about earlier, which is like your executive function, which helps with your focus and your planning, they don't communicate as smoothly with the other lobes in the brain. This leads to forgetfulness, word finding difficulty, and certainly slower thinking. You'll also tend to have somewhat of a sleep disruption as well. So as you know, with menopause, you have hot flashes and night sweats. So that can affect your sleep quality. You'll have your neurochemical changes as well. So you have your changes in your serotonin, which is kind of like your neurotransmitter that essentially makes you happy within the day, along with dopamine and acetylcholine, which affects like your mood and your motivation and your mental clarity. And then you'll also have elevated cortisol, which once again is that stress hormone, which can affect the hippocampus. So to answer your question, women often describe, I can't think as fast as I used to. I walk into a room and I forget why. I struggle to find specific words. And just my focus, ultimately, my focus feels off. So that's
my glasses on my head, but I can't find them. Yeah.
Yes, ma'am.
Yeah.
So those are those differences that you'll see.
Well, that's better than having shoes on your head.
Oh my goodness. Yeah. Yeah.
So go ahead, April.
I was just saying, Christian, you mentioned inflammation a number of times and everything that you've explained. Yeah. And, inflammation, as you know, I've read in certain articles, even when it comes down to my own health, seems to be like a root cause of a lot of issues that people experience. They don't realize that, I guess, the buildup of inflammation in the body is the reason why they're having certain conditions, right? So what are some ways that people can reduce inflammation in the body, but more importantly, related to what you're talking about tonight, in the brain?
Yes, and that's a really good question once again. So first let's talk about how inflammation affects the brain. So inflammation disrupts like neuron communications, and inflammatory chemicals called your cytokines can interfere with how neurons send signals to each other. And once again, it's a complex system. So it can affect the hippocampus. It can also change your brain energy use. So that's super important. And the root cause of this inflammation, it's so many different causes. And once again, it's genetic causes, it's environmental causes, it's also even like biological causes as well. So it's super important to know that as well. So that's different ways that you can learn about different ways of that root cause of inflammation. And there are different medications as well to control inflammation. And I'm not educated on like the medication of the specific medications for inflammation. However, your primary doctor will be putting you on inflammation and how to control that. And that's what I'll be writing on soon. I believe that's in a couple of my editions. And what I'll be talking about is your labs. So that's how doctors tend to know if inflammation is occurring within the body, is your labs as well. So you have your imaging and you also have your labs. So it's important to get both.
Okay. We do have another question, and this might be related to the thoughts of the aging brain versus, some of the conditions that may exist, and maybe not even related to the aging brain. It could be something else. But Stephanie Sessions Malone, thank you for joining us tonight. She says, what causes balance problems?
Yes. And, yes. And like I said, the NIH stroke score, test gate. So it's super important to know what causes balance problems. And within the balance problems, so within the brain, your balance problems typically occur in your hindbrain, and it's your cerebellum, and your inner ear, which is your vestibular system. So the inner ear acts like the body's motion sensor. If it's disrupted, you can feel spinning within your head. You can feel nausea. And like I said, you may have to take some Keppra, which is like a seizure medication. You'll have your unsteady walking as well. You'll also have vision problems. With your balance problems, you may feel off balance in dim light or unfamiliar environments. You may have depth perception as well, which may become harder. And then like I said, the brain control centers, your cerebellum is your main balance and coordination center. Your brainstem, like you were talking about earlier, that controls like your movement and your reflex control. And then you have your parietal lobe as well, which is your spatial awareness, deals with that. So there's a lot that kind of causes balance problems. Like I mentioned earlier, hypertension, which is your low blood pressure. You have dehydration, which is also super important to know as well. Dehydration can cause balance problems.
I don't think people really understand that. That's interesting, isn't it, Brother Edward?
Yeah, it's really interesting.
It's just a matter of being dehydrated. That's wow.
Yes, ma'am. Yeah, so dehydration can cause a lot of metabolic pathology as well. Low blood sugar, as we call it in medicine, is hypoglycemia. So low blood sugar can also cause blood balance issues. Sorry about that. And then, like I said, certain medications can cause side effects as well. And then alcohol or substance abuse can also cause balance problems. So it's important to just know about this because, like I said, I'm continually learning about like different medications that can cause these symptoms. And it's like I said, your brain is an interconnected network within your central nervous system, which is your brain and spinal cord, and then your peripheral nervous system as well. So it's really cool to learn about.
Man, you know, you're talking about dizziness and balance, keeping a balance. I didn't hear the word come up, which I've experienced a couple of episodes of vertigo.
Yes.
So how does that come into play?
I actually learned about vertigo, which is called BPPV. I actually learned about vertigo in my sports medicine and physical therapy. And vertigo, just to give everyone a background of that. So it's a specific type of balance problem where you feel like you or your surroundings are spinning. Like I said, it's spinning or moving when, you don't know what's going on. So it's kind of like a false sense of motion. So like I said, the vertigo starts in your inner ear, and that's called your vestibular system. So that system normally tells the brain where your head is, where you're moving, and whether you are still. So the common causes of vertigo are, like I said, it's called BPPV. Vertigo can affect your brain's balance centers. So it can cause cerebellum dysfunction. It can cause brainstem stroke. It can also cause tumors within the brain as well. Those are kind of like the more severe cases. And like I said, other contributors are dehydration. Like I said, the room is spinning. I feel like I'm on a boat. Like it feels like you're seasick. Essentially with in the vertigo, like how to treat vertigo, how they treated it in physical therapy, they did this like little maneuver. So the patient would be sitting on a bed and they would do this maneuver where they would like lift their head up really quick and it cures vertigo. It was so cool.
Oh really? a lot of people need to know that.
Yes. It was super cool to see. I was like, so at first the patient was like, their head is spinning, everything's kind of going on. And then the physical therapist, they did this maneuver where they like tilt your head like this, like they did it really fast. And it was so cool. The patient was like,
almost like a reset. It sounds like a sort of reset. That's crazy.
Yeah, it's so cool.
Well, that's knowledge, man. That's worth $1 million to me.
Yes.
I mean,
yes, sir.
I've had some episodes of that, so I expect to have more. Probably.
Yes.
Yeah.
Yes, sir.
So, Christian, as you were talking about Alzheimer's and dementia earlier, and what are some things that people need to understand in terms of, I guess, like the treatment plan for patients with dementia or Alzheimer's, if it's diagnosed that these are indeed the conditions and not just things that are happening because you're aging, right? Because we're trying to make the distinction between things that are happening just because you're aging and actually these two conditions that could be a part of your problem. So medication is one thing that we can address, but also is there any kind of cognitive therapy that can help a patient who is diagnosed with dementia or Alzheimer's? And also when it comes down to life expectancy, what does that look like? So those three things.
Yeah, and that's once again such good questions tonight. And I love that, right, like you said, Black Americans are it's true. It's important to know that Black Americans are disproportionately affected by these conditions due to social, structural inequalities, education inequalities. So it's certainly important to address these factors because it's crucial to maintain brain health and resilience. And it's so hard to understand the difference between, like you said, regular aging and this pathology that occurs. So when it comes to treatment, so you'll have, like you said, you'll have your medications. You have newer therapies, which are anti-amyloid therapies in early disease stages. For your vascular dementia, you'll have kind of like controlling your blood pressure, maintaining your diabetes, lowering your cholesterol. So we'll kind of try to attack that first to try to prevent future strokes. And you'll also have like anticoagulant therapy when appropriate. For Lewy body dementia, you'll have your medications. You'll also have management of sleep disturbances. So your primary care provider may put you through a sleep study to kind of see what sleep disturbances and movement symptoms you may have. And just like non-medication treatments, because once again, the primary goal is it's just so hard with dementia because it's such a deteriorating disease. So you'll have different mental exercises, whether it's, like you said, cognitive stimulation therapy. You'll also have occupational and physical therapy. So like Brother McQueen said, with vertical, they do that different technique that'll kind of help with your vertical. You'll have your speech therapy. You'll have your physical activity. And it's important, and I can touch on this all day because I didn't even mention this when I was introducing myself, but I played 2 sports in college. So I played soccer all my life, and I also did track my final year of college. And I learned so much within those sports that physical activity supports blood flow, and it supports brain health. Routine and structure is also important to reduce confusion and anxiety, especially if you're in assisted living. It's important to have that routine and structure within your life. And then it's also important to have family and friends within your life as well. That's the best
support system
that this world can give. Is a support system, because you can't do this life on your own. It's important to have caregiver support and medication to alleviate symptoms as well.
Well, I tell you, brother.
Yeah, you didn't talk too much about the diet, how that correlates with the development of dementia or
of treatment as well. Yeah, and I can certainly go into this as well. Diet as well. So it's important to, once again, Black Americans tend to have, like, you either have hypertension, you either have hyperlipidemia. Hypertension is high blood pressure. Hyperlipidemia is high cholesterol, or you have diabetes. Those are the top 3. And then you'll also have your cancers as well. So diet patterns linked to better brain health is actually like your Mediterranean style eating pattern. So you have your fruits and vegetables, you have your whole grains, using olive oil rather than canola oil, fish and lean proteins, nuts and legumes as well. You also can have like a DASH style diet. So that focuses on lowering your blood pressure, lowering your sodium, which once again, sodium contributes to hypertension. So it's important to lower your sodium as well. You also need to have foods that are high in potassium as well. So like I said, I've mentioned this before in a broadcast, my dad and I, which I've kind of took on, he loves to eat a banana and a yogurt every single morning. And that helps lower his cholesterol, and that helps lower his hypertension. So it's important to establish those diets as well. You can also eat leafy greens such as spinach or kale. Berries helps with antioxidant protection. Fatty fish helps with your omega-3s. Nuts and seeds are healthy fats for brain signaling. And like I said, the olive oil helps with anti-inflammatory effects as well. Foods that can worsen brain health, on the other hand, are highly processed foods like bacon, for example. That's high carcinogen. Sugary drinks, any type of energy drink is a no-no. You should not be taking energy drinks or drinking energy drinks with high refined sugar intake. Excess saturated fats as well, or foods that have high sodium are once again, you got to live. However, those can certainly worsen brain function.
Well, Christian, I tell you, you have given us a wealth of information tonight, and we appreciate all of the engagement from all of our viewers. And just want you to know that the April edition of World Community Magazine will be posted after this broadcast. But you can, right now, you can still go to WCMmagazine.net and pick up that March edition with this article on the aging brain and what neuroscience says about cognitive resilience. And it's the same thing that Christian was elaborating on tonight. So pick up your edition before I take it down and put up in April.
Yes,
because you'll want to put that one in your library. Go ahead, Christian.
One last thing as well. Thank you so much for that March issue introduction, and this upcoming April issue. I don't want to spoil too much, but it's on preventive medicine. So it's essentially what we've been talking about. And once again, shout out to Dr. Winston McIvory. He's my mentor. And I made sure to talk about mentorship within that preventive medicine article. So I'm super excited for that article to release. And it'll talk about everything when it comes to preventive medicine and a lot of what we touched on tonight.
Well, you need to go ahead and lock in sometime in, I guess, I can't believe that we're almost out of April.
It's blowing my mind.
This is crazy. All right, so let's lock in a date in May. You let us know when you're available to come in and expand and expound on the preventive medicine article, and I think that would be great. So, but so thank you so much for tonight. This is great. Some of the great comments coming in tonight. Carolyn Hickman Williams, thank you for watching. Great information shared tonight. Tara Hill Stark, smart young man. Blessings for a great future. Priscilla Fuller, thank you for watching as well. Let's see, Danica Rojas, awesome. And okay, create some menus. Create some menus, Mr. Newman. I love that. Yeah, Brother Eric, we might have to publish some menus or something in the magazine. How about that?
Yeah, that's right.
Yeah.
My wife and I do. We like to create menus every week.
Yeah. Chanel Jordan Reed. Thank you for watching, Chanel. Yeah, it's great to see you. Came in late, but very informative. You know, the wonderful thing about this broadcast is that it is on WCMagazine.net for the next week. So make sure you go back to our website, click on the video link, and you can watch this anytime you'd like, and share it. Please share this information with someone who could really use this knowledge. So thank you so much. Of course, do you know this man right here? He says, "Proud Dad."
I do. That's my dad.
Is that OJ?
Yeah. So thank you so much for watching tonight, for being here tonight. Yeah. So Brother Edward,
man, it's been good. As always, man, it's always good having you on. You know that.
Yes, sir. And thank you so much. And once again, this is dedicated to my grandmother. I miss her so much, and I love her so much. So thank you.
Yeah. Wow. Good, man.
Awesome. Well, thank you so much for being with us tonight. Again, we thank our audience for joining us tonight. Please make sure that you lock us in for next Tuesday night at 7 p.m. We have one of the youngest authors that I know, Aiden Wilkes. He is 9 years old and just published his first book. But Aiden is also a dynamo in terms of just everything that he's done in 9 years of life so far. He is an actor. He's a singer. He's a star baseball player. Now he is an author. And who knows what else he's going to add to his repertoire. Can't wait. But can't wait to see him. As a matter of fact, I'm going to put up his book real quick here. The Journey of Number 9 is the name of his book. It's a great chapter book. It is for sale. So this is great to share with the kids, and a great read for the family, actually, because it chronicles his story of how he journeyed into the baseball league that he plays in now. He is a member of the Canes out of Lawrenceville, Georgia, and they are doing some big things. So Aiden's Road to the Big League, The Journey of Number 9. We're going to have Aiden Wilkes on the show next week. So everybody, please tune in to see my godson. He's also my godson.
That's so good.
Very, very proud of him. He is the son of Fred and Letitia Wilkes, and the grandson of the late great Mr. Pete Wilkes and Mr. Skeet Jones. So Whittemore greats. And this is the legacy right here. This is the legacy. So we just thank everyone for joining us tonight. And again, go to WCMagazine.net to view the latest edition of the magazine, to see the rebroadcast of this show. And we thank you all for your support. We really do appreciate it.
Absolutely. April, this was such a success. I just had to say something about it. And speaking of authors of books, this past Saturday, right, when they had this famous book signing by none other than our illustrious author, Miss Cassandra Chestnut. And she was there to sign it, along with whom the book was pertaining to. Was Reverend Lonnie Chestnut, who's 97, And
Dad.
they were, they were there signing his books, and that was an awesome setting. I mean, people were just lined up there, wall to wall. There was just such an awesome sight to see.
And we're going to have some more great authors that we will feature. If you know of a great local author who's just released a book, let us know. I was in contact with one today, and I'm so proud of her. I can't wait for us to share her latest literary piece. And so this is wonderful. Again, we'll have Christian back next month, May. Woo!
Yeah.
May. Oh my goodness. We'll have you back to talk more medicine. And so we just hope that everyone has a great rest of the week. And Christian, keep studying hard, doing what you're doing, you and your wifey. And
he's just following right behind his wife. She's there first, but he's coming behind.
Yes, ma'am. Yeah, so I just had an interview at at the Greenville Medical School. So we're going.
Yeah.
We're going.
All right. Well, we wish you well. Absolutely. All right. Well, everyone, thank
Godspeed.
you. Take care. Have
Thanks,
a good
man.
night.
Thank you for watching the World Community Magazine's Hour of Power Live on Facebook.